actually the pandemic brought a lot of awareness to what COVID did to the body and to the mind. We understood and we understand now that because of the pandemic, we developed another pandemic, which was the mental health pandemic that we are dealing with right now. And that's not an endemic, we're still in the pandemic because we see it all the time. But what happens for the Latino people that I've seen in my practice and throughout different practices and while talking to other people is that we carry a lot of I would call it to a certain extent resistance that it comes based of, okay, first of all, I'm not crazy, okay, no estoy loco. I'm not gonna go and see a mental health clinician because I'm okay. I'm a Latino, what the heck? What is depression for Latinos, right? Well, what the pandemic did was it actually came and brought this awareness that we all could suffer, could become more stressed out, and could become more impacted by the emotional reactions of what happened. And when did it start happening? When the concept of family started to be attacked. And when did the concept of family started being attacked? Is when they were actually seeing their grandparents, their parents dying. For us, in the Latino community, we have the respect of the elders. Everybody goes toward and see our grandparents, and we all provide the care. And same thing to our parents if they're older. But what happened during the pandemic, they started dying. And out of something that at the beginning, it was like, no, I don't understand what this is, I don't even believe it. Might be a political reason why we're even going through this. But then when things started happening, that's when reality started hitting to everybody. So the whole concept of understanding I'm crazy started being, wait, I'm not, it's not that I'm crazy, it's just that this is real now. And then they started coming to believing that the symptoms that are happening, especially for the Latino community, it's a little bit different than how a clinical depression or stress or anxiety would present. Latinos internalize, we somatize, we actually start suffering from body aches, headaches, and everything else. And we started seeing that more and more and more, to the point that no medical provider could even alleviate that, because obviously the reason is not necessarily for medical reasons, but it is for deeper emotional reasons. And I'm not saying that this is in the Latino's head. Okay, well, if we were to think about the brain and neurotransmitters being stabilized, then we could say it's in the brain. And it's true, because everything that happens in the brain happens in the body. Everything that happens in the mind happens in the body. Mente sana en cuerpo sano. I grew up believing that. And now medicine is incorporating that aspect of that. So the changes that I've been seeing is that now they are realizing that they are suffering from stress, that they are suffering from depression, that they are suffering from grief, they're suffering from loss. And that in itself is creating changes even in their behavior. Whereas before, due to machismo, feminismo, familismo, they would be, no, I'm strong, I have my support system. This time, I'm losing my support system. Who do I go to? What do I do? That's why it is very important for us and for all of us who look like you to be there as well, or to speak like you, to know about you. And that's what's important. It's about bringing awareness about what the other person is welcoming. I keep on saying this statement, in our field, it is not treat others as you like to be treated, because then you're becoming selfish. In our field, we treat others as how they like to be treated. And that's what makes an essence and a difference into being able to help somebody else. So part of the difference is that understanding that COVID depression is not the same as clinical depression is one of the biggest messages. A clinical depression requires several ways of different treatments, including medication. Depression due to COVID, it's a different approach. It's a different way of addressing, it's a different way of conceptualizing by bringing how pretty much the person has been affected due to a transitional or an adjustment condition, which is COVID. But it's hitting people, and it's hitting all of us. So that's why we don't want to turn it into a clinical depression if we act faster, if we prevent the more serious symptoms to continue happening. So part of your job is to be able to identify when the person's function starting to be affected. And then from there, you want to prevent to continue not letting it develop into a clinical depression. So two different things, and this is the awareness that now we're understanding more and more in the Latino community. It is to suffer from what looks like depression, anxiety, or even some other type of more serious conditions. It's not necessarily that we are crazy. It is that we are acknowledging that we're humans and we are suffering from something.